You're live on News 360. Hello, my name is Joyce Midley.
And my name is Pakwisi Asari.
This is the PTS Ebola Treatment Unit in Hastings, and we just entered the holding center. These people have just returned from the red zone. By the end of the day, is it worth it, the work you do? Are you happy? You're doing it with joy. From the Redemption Hospital in Monrovia.
We are still at the verge of saying thank God. We are, but completely we are not at risk.
Narkwor Kwabla reports on the devastating effect of Ebola on Sierra Leone and Liberia and the road to recovery, only on TV3 News.
Now, Liberia already had a few doctors before Ebola struck, infecting over 300 and killing more than half of this number.
So Narkwor Kwabla reports the biggest challenge now is the lack of doctors and nurses to fill the vacuum left in the hospitals.
Redemption Hospital in Monrovia was an epicenter of the Ebola outbreak. It automatically turned into an isolation center, admitting only Ebola cases. The hospital lost 10 of its medical staff, while others who were frightened fled.
You can just imagine, say a war, and you are a soldier, and you are hearing about the death of other soldiers. It will frighten you for you to go to the war front. That's exactly what happened with the health workers.
Under strict infection prevention measures, the hospital has reopened its services to the public. The same facility was selected for the Ebola vaccination trial. The Redemption Hospital is undergoing a restoration program to make it fully operational. Some Ghanaians under the African Support to Ebola Outbreak in West Africa, SEWA, served on the front line here and are now restoring essential services.
We've been telling them in a meeting that they should help and bring even medical officers to enable us put hands and so that it don't be stressful on us. So all the departments, they are lacking, but it's worse in obstetrics and gynecology.
Liberia used the unfortunate outbreak to build the capacity of its health workers, using resources and expertise from the international partners, but the number of health workers are still marginal for the population.
We were making very steady progress after our 14 years of crisis to rebuild the healthcare system, and then Ebola have turned us to zero. So ECOWAS, African Union, everybody needs to come together to help this country.
Hospitals like Redemption, worst hit during the outbreak, have learnt painful lessons.
We are still at the verge of saying thank God. We are, but completely we are not at risk. One should not be careless. Every step and every patient that comes here, we must look at that patient as an Ebola patient until otherwise proven as being non-Ebola.
This hospital was in the news for the wrong reasons, and since then they say they have learnt their lesson. In the initial stages, fear and misinformation was the major problem, but all those lessons have been learnt and life is getting back to normal, but still very cautious that the disease is still around. From the Redemption Hospital in Monrovia, my name is Narkwor Kwabla, reporting for TV3 News. This is the PTS Ebola Treatment Unit in Hastings, and we just entered the holding center. These people have just returned from the red zone. By the end of the day, is it worth it, the work you do? Are you happy? You're doing it with joy. From the Redemption Hospital in Monrovia.
We are still at the verge of saying thank God. We are, but completely we are not at risk.
Narkwor Kwabla reports on the devastating effect of Ebola on Sierra Leone and Liberia and the road to recovery, only on TV3 News.